Well, now, this is a word that you managed to learn this morning by repeating over and over again like a little mantra in makeup. What is it again?
Biodynamic craniosacral therapy.
Very, very good.
I know, but I will not be able to tell you exactly what it is, but lucky our two guests today can. So do join us in welcoming Mr. Steve Haynes, who is a biodynamic craniosacral therapist.
Thank you.
And Miss Pat Chiu, who is a recipient of the therapy.
Yes.
Yeah, there goes the
There we
team of the therapy.
Welcome to the show. Thank you very
you.
much for coming in this morning. Okay, maybe you can tell us, first of all, what exactly is biodynamic craniosacral therapy?
And if there is a shorter name to it.
Cranial work is a good way of
Cranial
shortening
work,
it.
okay.
So cranial describes the bones in the skull.
Right.
The initial insight in the work was the whole body expands and contracts, and particularly the bones in the head express this movement of opening and closing.
Oh.
So the skill in the work is to feel those rhythms. It's not just the bones in the skull. All the bones move, all the cells, all the organs expand and contract.
Mm-hmm.
And the skill of the therapist is to listen to those rhythms and allow them to move in an easier, more balanced, more harmonic way.
Right, so, I mean, how quickly are these
Yeah.
things moving? I mean, because I don't really feel them when I
No.
see.
But it's a good question. Can you feel your heartbeat right now?
Yes.
Yes.
You can.
Well, if you put your hand
put your
there.
hand to it,
That's
yeah.
there. But you have to slow down a little bit to feel that. So just in the same way that you know your heart is beating right now, once you've felt the cranial rhythms, they're unmistakable, but it takes some skill to do that. And the basic cranial rhythm is much slower than your heartbeat. So your heart's 60 to 80 times a minute. Your breathing is 16, 20 times a minute. Basic cranial rhythm is about 10 times a minute.
Really?
And then there's a slower rhythm that's about 2.5 times a minute, and there's an even slower one that takes 100 seconds to complete. Cranial work is very, very gentle, and the skill in cranial work is we just listen and allow things to change. So something about the body choosing to let go of shapes and patterns from the inside rather than us forcing something from the outside. I do cranial work because I get fantastic clinical results. I
Right.
spent 5 years training as a chiropractor, 3 years as a shiatsu practitioner. I worked around people for a long time. It's from acute and chronic pain, so people hurt their back or people have long-running sports injury, to people who can't sleep or people who have energy problems. I've also worked with people who've got very, very serious diseases, so helping them cope with medication, helping them cope with coming to terms with their diagnosis. It's also fantastic for stress, for people who have difficult emotional stories, so being depressed or being anxious. Cranial work, I think, is probably one of the best therapies out there for something like panic attacks and things like that. Another thing it's very good for is because it's so gentle and respectful, it works with babies.
Oh, wow.
A lot of the work in Europe and in America, it gets well known for is it's working for babies.
All right.
So it's psychological and physiological at the same time.
One way of describing it is sort of silent psychotherapy, really. So we listen to the body tells our stories, and our mind and emotions catch up with what's happening in the body. So that's the interesting thing about being a body worker, is that you can listen to the story of someone and feel and begin to know who they are by how their body shapes, how it moves, how you feel these rhythms, these expansions and contractions going on in the body.
Can you actually diagnose problems from...
Absolutely.
Wow.
So if you were looking at someone breathe and they were breathing, you might begin to think they're a little bit anxious, they're a little bit stressed, they've been running around, they've been working too hard. And if you listen to their breathing and they begin to breathe nice and slowly and they begin to slow down, you might feel a bit calmer, a bit more relaxed, they've got a bit more energy going on. And it's the same with the cranial rhythms. They're very information rich. They tell you lots about the health of someone.
So I went and had it done, and my goodness, she did a session of about 45 minutes on me. And actually, when I went to her house that time, I was actually limping. My pain was quite bad at the right leg, and I couldn't even walk properly. But after doing the session, I felt I was so light, and the pain absolutely left me.
Wow.
And I felt so good.
But what were you diagnosed by the doctors?
Actually, I do have a little bit of what you call depressive moods in me, and I think hormones changes a lot in me. So pains and aches always come, and I'm unable to sleep also.
Right.
But after having the session done, I was feeling really good.
Great.
And
how long did that last for?
For a couple of weeks.
Oh, wow, great.
You know, and I had 2 sessions done by Jennifer, you know. and I was feeling good.
Wow. So how many times did you go through the session to actually notice the aches, the physical aches and pains
disappearing?
I went once a week, once to her.
Yeah, so I mean, generally sessions between 3 and 6 sessions, people get a sense of whether it's going to work for them. Sometimes you get fantastic results in one session. Sometimes it's 6 months of hard work. How long is a piece of string, really? Everybody's different. But
Right.
I think within 3 to 6 sessions or 6 to 12 sessions, you'll get a sense of whether it's going to work for you.
And of course, I mean, this lessening of pain is without drugs or without medication or anything
Yes,
like that.
without.
Oh yeah, the cranial work is very much around the inherent power in the body to heal itself. So we facilitate those conditions.
Wow.
There's 2 big ideas. One, there's all these rhythms going on in the body that you can feel and interact with. The other big idea is that there's a real intelligence in the body. There's millions of years of evolution behind how things move, and it's very, very precise. So the smartest thing in the room is the intelligence in our bodies, and cranial work is about allowing that intelligence to express itself. And when it works very, very quickly.
Right. Okay, so how long is a typical session? Because I know that you're mentioning you have about 45 minutes. Is that about?
Yeah, it's typically the hands-on time is about 30 minutes. People coming in and out and lying down. We work with people through clothes, so people don't need to get changed.
Do they use special equipment or anything, or
Just
your
hands.
hands?
That's the special equipment. The skill it takes a number of years to learn the skill. So we run a 2-year training. So why we're here in Malaysia is we're trying to spread the word.
All right.
Our organisation is called Body Intelligence, and we're setting up training schools in Malaysia. But also, kind of the work came from America. It's very popular in Europe and is beginning to spread into Australia and Middle East. We've got a training course going in Dubai, hopefully.
Well,
The founder of the work was an osteopath called William Sutherland. He started writing about the work in the 1930s.
Oh, wow.
So it's, and his first insights were a little bit earlier than that. So about 100 years, I'd say.
Excellent. And okay, so obviously you're saying that people can learn this skill and can be trained in it. Do you need to have some sort of special gift in order to do this? Is he like a faith healer, or you need to have some sort of powers or energies?
No,
Or?
I think it's inherent to being a human being. I think if you were to hug a friend or a partner or a relative, you'd immediately know if they were happy or sad, if they were angry, if this was going to be a good day or bad day hanging around them. There's all sorts of clues in the body, and so we're all experts at perception. Cranial work just refines that ability. It helps you listen more deeply, helps you
Tune into the
rhythms. We think certain events, certain movements are quite important, and if those movements are quite clear, if the head is expanding in an easy and balanced way, there's a sense of fluid coming up and around the brain and the nervous system and sinking back down, that's a very good indicator of health. It takes a little bit of time to do that. Most people, you guys are good, you could feel your heartbeat or you know your heartbeat. If you ask most people, it takes them a while to tune into their heartbeat, and it's a struggle. But once you learn the skill, you know your heart's beating. And once you felt the cranial rhythm, you know it's there and you can begin to interact with it.
Can you practice it on yourself?
Absolutely.
You can.
you can.
It's really, this work is about becoming more aware of who we are, how our body moves, how it shapes itself. So part of the work is very much about learning to be in a body. I often say, pain is like your body screaming at you, there's a problem. It's saying 8, 9 or 10, there's a problem. Through more awareness, you can learn to spot the 1s and 2s and 3s.
Great. And how long was the course?
The course is 2 years. So
okay, right.
It's a proper training.
And it's run entirely in Malaysia, or?
In Kuala Lumpur, yeah.
Okay.
So and it's 10 weeks over 2 years.
Okay, and where's your centre, if you have a healing centre? Or there are several?
In Petlanjaya. I'm still...
Right, not to worry. It's very good. It's very good. No, not too bad.
That's my struggle to learn the phrase.
Not to worry. Not to worry. Well, I'm sure the address and everything is on the website as well.
It is,
right?
absolutely.
So make sure you log on. We've got the website up on the screen right now. And Pat, perhaps for everybody out there who might be thinking, well, should I go? Shouldn't I go? Would you
recommend it?
Yes, really, greatly, yes.
For any problem, really, right?
Yeah, just to get relief, and even if you are very stressed and tense, it's good to go and have a try for a treatment. Yes.
Right. Well, there you go. I think.
You don't necessarily need to be ill to actually go through a treatment like this. It's really good, like you mentioned.
Who isn't stressed and tense right now?
I think everybody is stressed and tense here in Kuala Lumpur especially, so it's a great place to have this. So thank you so much, Steve.
Thank you
so much,
to meet
Pat,
you.
for being on the show.